The revenue cycle in healthcare is the most complicated revenue cycle that any industry has. Without having it run correctly, healthcare doesn't work. If you went back to the 70s, rev cycle in healthcare was pretty simple. Person either paid you or they had an indemnity policy, you dropped a bill, they sent you 100% of charges minus a copay. Other than when we do extremely major things like build a building or something of that nature, where we may take out additional debt, everything else has to get funded either through donations or primarily through our operations. And so all the new clinical equipment, any additional staff that's needed, staff training, charitable works that we do in our communities, all have to be funded through operations, and this additional cash would be going towards that. Our depreciation in a given year is about $32 million. We've funded about half of that on a routine basis, about $16 million, which means our age of plant, age of all of our equipment is pretty old. And so we're trying to actually get closer to that $32 million on an annual spend. And a lot of that is going to be new IT, upgraded IT, new MRIs, CAT scans, other radiology equipment, outfitting MOBs, purchasing, building new practices in our community. That's really just our business model, is the health of our communities. We not only invest in the clinical programs at the hospitals, we have very substantial ambulatory footprints in all of our communities. We employ a very high proportion of both our primary care physicians and our specialists to make sure that the communities have access to specialists, especially in Maine. You've got a very rural, footprint. Whole state's basically rural. We hire specialists to bring to those communities and make sure that programs are supported so that communities can have access to care that they, in other circumstances, they just might not have access to. And, nips things in the bud before they become serious and they wind up in an emergency room. We tend to think in healthcare about, the patient interactions as being really about nurses and doctors and other clinicians. That frequently is easier, I think, to get to a good patient experience because I felt bad. I went in, the nurses and doctors made me feel better. We're all good. The interactions before that, though, and after that are all revenue cycle. You're talking to the people that are trying to get you to, schedule you, get your insurance authorization, register you, get you into the system. And then at the backside, you are dealing with people that have billed your insurance or are billing you and are collecting money from you. At the front of this process, it's, time consuming and can be frustrating and can be, challenging to understand what it is you're supposed to be doing as a patient. And so you may not really be happy about it. Afterwards, somebody's trying to collect money from you. So you're probably really less likely to be happy about it. Having good processes, both at the beginning and at the end, that, are simple as possible, as efficient as possible, well scripted, people that are good at interacting with the patients. Healthcare is expensive. It's a premium product. So it should be a premium experience. It should be like going into a Neiman Marcus. You should be able to be treated, in a very high-end way, high-touch way to make sure that to set you up for having a good experience and to leave a good, lasting impression. An organization I was at some time ago had a woman present who went by, she was Chinese, but she went by an American name with her primary care physician, and she went by her Chinese name with her specialist. And they had a record at the hospital under both names. And the registrar got the records, crossed, and the person wound up missing their surgery because they couldn't get the records for the surgery. Everything turned out okay in the end, but it shows how doing it right impacts getting it right later on. If revenue cycle doesn't work, hospitals don't work. They are an integral part of the organization. They're integral to our mission. They're integral to the care of our patients. Without them, none of the rest of that actually can come to fruition.